Okay, Australia, stop and listen, because I'm going to expose one of the biggest government corruptions and cover-ups that's been going on for the last 16 years that works in secrecy. In 2024-2025 budget, $2.8 billion was dedicated to Medicare to help strengthen our health system. So why is it worse than ever? Why is there ambulance ramping? Why are waiting rooms in ERs absolutely packed? I'll tell you why. Because of the secret organisation PSR, the Professional Service Review. And why I say secret is because doctors are prosecuted by them for bulk billing their patients, for treating large numbers of patients, for treating walk-in patients, for working tirelessly to try and help the most vulnerable in the community. When a doctor is brought before, 5,000 to 8,000 charges, one charge per patient that they bulk bill is just the beginning. So when a doctor has 5,000 to 8,000 patients, that's 5,000 to 8,000 charges immediately. And PSR, who brings these charges about, they are the ones that then also have to determine the facts. There's no independent lawyers, there's no judges, there's no jury, there's nothing. There is PSR versus a GP. So that is why they have a 100% conviction rate. No court in the world has a 100% conviction rate, yet PSR do, because they're judge, jury, and executioner. Now, sure, they offer doctors a way out by paying fines in excess of $1 million, but if a doctor stands up to them, that's it. Doctors have criminal charges brought against them for even discussing what happens during these PSR investigations. They're killing themselves. Doctors are committing suicide because of what PSR has done to them. These are medical professionals that have worked their entire lives to help people, to uphold their oath to do no harm, and yet they're forced to either conform and not bulk bill, they're forced to conform and limit their patients' numbers, even though they can competently treat many, many more. They're forced to go before this system because there is no one higher than PSR. In 12 years, one doctor who's taken this to the high courts has won. One. So if they don't win with the high court, they're referred back to PSR's system, back to PSR's three wise monkeys who brought the charges against them in the first place. There are some places, some clinics that have GPs that I have spoken to who are terrified. They're terrified of having their licenses taken off of them for doing the right thing, for treating their patients, for using Medicare as the way it's designed to be used according to what the Australian public's told. 10 years ago, you could go to pretty much any GP and they were a bulk billing clinic. Now, there's always a gap fee. And sure, for some, if you fit the 10-minute walk-in, walk-out criteria and it's like $22 or something, then good for you. But majority of people don't. And it's the people that are the vulnerable ones. Those with complex issues. Those that need to see specialists but can't afford to wait 3 or 4 years on the public health system. So doctors that are more than competent and trained to treat these patients are being threatened with their livelihoods, with their reputation, with their years of study. They're bought nothing. They're given nothing in return for their commitment and hard work from the government. But instead, they're stamped out. One by one. Anyone that opposes them, any doctors that oppose them, they're stamped out. We need to put an end to this before our healthcare system ends up just like the rest of the world's. Please sign the link, click on the link below, read the petition and sign it today.